The first cranial nerve I'll be testing is olfactory nerve, which is sensory, testing the patient's sense of smell. So you'll have them close their eyes and occlude one nostril, and you will place this in, what do you smell? Vanilla. And then you'll occlude the other nostril. You smell the same? Okay, so then she's perfectly intact. Things that you could, any type of smell, lemon, lavender, we use vanilla, just distinct smells that you can tell right away. And you don't want them to see the bottle. Test cranial nerve 2, which is optic nerve, and it is only sensory. You will be doing 2 parts. First, since we don't have this in the apartment, but you would do a Snellen's test, which is the big letter chart that you would see at the doctor. You stand 20 feet away, you cover one eye and the other eye, and you read the numbers as they appear on the sheet. But you can also test peripheral vision. So you will sit about 2 feet away from your patient, and you'll have them cover one eye, and you will cover the opposite eye. So she has her left eye to my right, and I will be want her to maintain gaze with me and let me know when you see the pen.
I see it.
And you will come in at different angles.
No.
And then you will test the other eye separately and do this, repeat the same way.
Yeah, I see it. I see it. I see it.
We will now be testing oculomotor, which is cranial 3, cranial 4, which is trochlear, and cranial nerve 6, which is abducens. These are all tested together. They're all motor and looking at your eyes and how they move. So first, just by observation, you'll look at the patient and see if their pupils are the same size at both eyes. Also looking at their eyelids, making sure they don't have ptosis, and that both are equal there. Then we will get into the pupillary reflex. So you'll have the patient look over your shoulder and gaze at a distant object, and then you'll come in 20 centimeters and shine light in one eye, and you want to look for both pupils simultaneously constricting, and then you'll do the other eye, and it's the same for that. Then we'll look at convergence, so you'll have them look at just a pen, any object, and follow it in, and they both should converge together. Next we'll be looking, you'll have them again follow this, so I'll have you look up into the corner without moving your head, and back to the middle. And you want to make sure you hit every corner. Over to the side, and then straight up. Both eyes should be moving the same direction. You'll look for nystagmus in this. There could be just involuntary movement of the eyes. We'll be testing cranial nerve 5, which is trigeminal. It is both sensory and motor. So first you can start with the sensory portion. So have the patient close their eyes, and you will do 3 spots, and let me know. You feel it? Mm-hmm. Mm-hmm. And you can do sharp or dull, whatever you want to do for that. Next, we will be doing the corneal reflex. So have the patient look up and away, and then you will touch their eyeball, and they should blink with the reflex as soon as you touch it. Next, we will test temporalis. So you'll put your hands on the temporalis muscle and have the patient clench their teeth, and you will feel the muscles bump out into your hands. And then we will test the opening of the mouth, so have the patient open their mouth, and then move it side to side and back closed. And you'll be looking for just that they can do that. Now we'll be testing cranial nerve 7, which is facial nerve. It's both motor and sensory. So for the motor part, we will have your patient, you'll ask them if they can smile and show their teeth, and then you'll ask them if they can frown. Then you'll ask them if they can lift their eyebrows, and then close their eyes really tight. Should be looking for just bilaterally, both sides are doing the same thing. Then for the sensory, we will have them stick out their tongue and drop. And what do you taste? And you want to make sure you taste on both sides. Now we'll be testing cranial nerve 8, which is vestibular cochlear. It is sensory, just testing hearing in the patient. So you'll be about 50 centimeters away, and you'll have them cover their opposite ear, and you'll whisper a 2-digit number, and they should be able to hear it.
22.
And then you'll repeat on the other side, and then we'll close that ear. Now we'll be testing cranial nerve 9 and 10, which is glossopharyngeal and vagus. Both of these are mixed, sensory and motor. So first you'll have the patient open their mouth and say ah, and you'll be looking for the uvula, and you want it to be midline, no deviations. And then you will, throughout the whole, you'll be assessing their voice, making sure the quality, it's not hoarse, anything like that. And then you will ask them to swallow. Any pain or difficulties with that. And then you can test the gag reflex, so have them stick out their tongue, and then you'll point, and you will do both sides, and the reflex should be present. We will next be doing cranial nerve 11, which is spinal accessory. It's strictly motor. So first we'll look at the SCM. So you will palpate the SCM, and then you will have the patient push against your hand, and you'll feel their strength, and then you will again repeat on the other side. And then we will look at trapezius. So you will put your hands on here and have the patient shrug, and there should be full strength with that one as well. For the last cranial nerve we'll be testing is 12, which is hypoglossal. It is motor as well. So you will give the patient something to read and just have them read a few lines. Their tongue plays a key role in forming words, so looking at that. And then you also have them stick out their tongue, and you want to make sure it's symmetrical on both sides, and as well as it doesn't deviate to one side or the other.